Good afternoon, everyone. My name is Grace. Hypertension is, our topic today is hypertension among Black pregnant women in Brockton. And hypertension is when we have the systolic blood pressure more than 130 and the diastolic more than 80. We call it hypertension during pregnancy, hypertension disorder pregnancy. And CDC data show that hypertension is increasing and during pregnancy is increasing from 30.3% to 15.9% and from 27 to 2019, mostly in Black population and women aged greater than 35 years old. Hypertension important. Why important? Because heart disease is the second cause of mortality in Brockton. Even though we have some reduction, it's still high at the state. When we compare it to the state level, Brockton community principally has like 100,000, more than 100,000 of population, mostly female in their fertility age of reproduction. And mostly they are Black, with 2.9% without health insurance. And we have found that the risk factor that is associated with hypertension is smoking, obesity, physical inactivity, and drinking. We're gonna use the CBP method or the way we're gonna involve the community from identifying their needs, finding the right program for them. And so we're gonna use the focus group intervention on to understand on their needs, to get their perception, their barrier, related to hypertension during pregnancy. Our program name is Hypertension on Awareness and Screening among Black pregnant women in Brockton. Evidence-based program we're gonna be using is the ACAMP, which named to improve public and healthcare provider awareness and management of hypertension in adults. It was implemented in Canada, so we're gonna use this example of program to create a new program in our community or to adapt this program to our community. So we're gonna involve volunteers in our community, from our community, and our writing material will be in different languages since we are working with different races and ethnicities. So the information we're gonna be involving in these writing materials gonna be effect of hypertension in mothers and babies, how to manage their blood pressures, or the identification of risk factors. But before starting implementing the program in that community, our volunteers and pharmacists will go on that training, and where some of them gonna be learning about hypertension, other one about treatment and the recent treatment of hypertension. Also, we're gonna be holding like the workshop where the community members, physicians, pharmacists, health educators, nurses will be reviewing and refining our program goals. So participants in this program will be recruited through letters of invitation or advertising. And our program will have 2 sessions, education session where they're gonna be learning about hypertension. And after that session on, we're gonna be taking their blood pressure, and it's gonna be the nurse who gonna be taking their blood pressure. After that step, we have set up online consultation appointment with retirement medical practitioners to give them recommendation, principally the one who has high blood pressures, and our volunteer pharmacists. So we're gonna set up appointment with their gynecologist if our participant gynecologist, and participants without gynecologist will be followed by pharmacists, and their medical story will be sent to a particular hospital for further care. Our evaluation program is very important since we're gonna demonstrate to our funders that our program is working. Also, evaluation program will help us to see where we have to improve, identify where we have to improve. Those are our evaluation questions. And the one we're gonna be working on, we're gonna be evaluating how much does our participant knowledge is about blood pressure increase from the beginning to the end of the program. So to do that, we're gonna use one pre-test and post-test design, where we're gonna be using a questionnaires to measure their knowledge at the beginning and at the end of the session. As well as we can use observation methods, where we can see how participants, they are monitoring their blood pressure, they are taking, and they can translate that blood pressure, if it's high, low, what is the step they have to take. And this type of design have limitation, testing and instrumental limitation. But the advantages is because it's simple, cheaper, and we are working with only one group of participants, so it's easy to implement it. And in conclusion, our program goal is to improve our maternal and fetal health outcome in Proton community by focusing on education, awareness, access to resources, empower our participants with knowledge. And thank you. Thanks. Bye.